Oral hygiene is an essential aspect of maintaining good dental health. It involves taking care of your teeth, gums, and mouth to prevent dental problems such as tooth decay, gum disease, and bad breath. Here are some oral hygiene tips and techniques for healthy teeth and gums. Brush twice a day. Brushing your teeth twice a day is an essential part of oral hygiene. Use a soft bristled toothbrush and fluoride toothpaste. Brush for at least 2 minutes, making sure to clean all surfaces of your teeth, including the backs, fronts, and chewing surfaces. It is recommended by dental professionals that you brush your teeth in the morning and before going to bed at night. Brushing your teeth regularly can help prevent tooth decay, gum disease, and bad breath. Fluoride toothpaste helps to strengthen tooth enamel and prevent tooth decay. To brush your teeth effectively, place the toothbrush at a 45-degree angle to the gum line and use gentle circular motions to brush the fronts, backs, and chewing surfaces of your teeth. Additionally, brushing your teeth can also help to remove surface stains caused by food, drinks, and tobacco products. Floss daily. Flossing helps to remove food particles and plaque from between your teeth that your toothbrush cannot reach. Use a piece of floss that is long enough to wrap around your fingers and gently slide it between each tooth, making a C shape around each tooth. Flossing helps to remove plaque and food particles that may be stuck between your teeth and gums, which can cause tooth decay and gum disease. To floss your teeth effectively, use a piece of dental floss that is long enough to wrap around your fingers. Hold the floss tightly between your thumbs and index fingers and gently slide it between your teeth using a back and forth motion. Flossing your teeth regularly can help prevent cavities, gum disease, and bad breath. It can also improve your overall oral health by removing harmful bacteria and promoting healthy gums. Some people may find it difficult or uncomfortable to floss their teeth, especially if they have braces or dental work. In such cases, dental flossers or interdental brushes can be used as an alternative. Use mouthwash. Mouthwash can help to kill bacteria and freshen your breath. Look for a mouthwash that contains fluoride to help strengthen your teeth. Swish the mouthwash around your mouth for 30 seconds before spitting it out. Mouthwash, also known as oral rinse, is a liquid solution that is used to kill bacteria and freshen breath. Mouthwash can be used in addition to brushing and flossing to help reduce the amount of harmful bacteria in the mouth. Most mouthwashes recommend that you rinse your mouth for 30 seconds to 1 minute, swishing the solution around your mouth and between your teeth. Some mouthwashes may require that you dilute the solution with water before use. There are different types of mouthwashes available, including those that contain fluoride to help strengthen teeth and prevent tooth decay. Others contain antibacterial agents such as chlorhexidine or essential oils to help kill bacteria and prevent gum disease. Limit sugary and acidic foods and drinks. Sugary and acidic foods and drinks can cause tooth decay and erosion. Try to limit your intake of these foods and drinks and choose water, milk, or unsweetened tea instead. Consuming excessive amounts of sugar and acid can lead to tooth decay and erosion, which can cause dental problems such as cavities, sensitivity, and discoloration. Sugary foods and drinks, such as candy, soda, and juice, can provide a breeding ground for harmful bacteria in the mouth, which produce acid that can wear away at tooth enamel. Acidic foods and drinks, such as citrus fruits, tomatoes, and sports drinks, can also erode tooth enamel over time. To limit sugary and acidic foods and drinks, it is important to read food labels and choose products that are low in sugar and acid. You can also try substituting sugary drinks with water, unsweetened tea, or milk. In addition to limiting sugary and acidic foods and drinks, it is important to maintain a balanced and nutritious diet that is rich in vitamins and minerals. This can help to support healthy teeth and gums and prevent dental problems. Eat a healthy diet. A healthy diet can help to promote good oral health. Eat foods that are rich in calcium, such as milk, cheese, and yogurt, and foods that are high in vitamin C, such as citrus fruits and leafy greens. Visit your dentist regularly. Regular dental checkups can help to identify dental problems early and prevent them from getting worse. Visit your dentist at least twice a year for a checkup and cleaning. Regular dental checkups can help to prevent dental problems, detect problems early, and treat any issues before they become more serious. During a dental visit, your dentist will examine your teeth and gums, check for signs of tooth decay, gum disease, and oral cancer, and clean your teeth to remove any plaque or tartar buildup. They may also take X-rays to check for any underlying issues that may not be visible to the naked eye. In addition to providing preventative care, your dentist can also provide advice on how to improve your oral hygiene habits and recommend treatments or procedures to improve the appearance and function of your teeth. Children, pregnant women, and people with certain medical conditions may also need to visit their dentist more frequently. If you experience any dental pain or problems between regular dental visits, it is important to schedule an appointment with your dentist as soon as possible. Ignoring dental problems can lead to more serious issues and may require more extensive treatment in the future. Don't smoke or use tobacco products. Smoking and using tobacco products can cause gum disease, tooth loss, and oral cancer. Quitting smoking and using tobacco products can help to improve your oral and overall health. Use a tongue scraper. A tongue scraper can help to remove bacteria from your tongue and freshen your breath. Gently scrape your tongue from back to front, rinsing the scraper after each pass. Bacteria on the tongue can lead to bad breath and can contribute to the formation of plaque and tooth decay. Tongue scrapers can be made from a variety of materials, including plastic, metal, and silicone. Thanks for watching.